My name is Supreet Shah, and I am at the Truspine Chiropractic and Acupuncture Clinic here in San Francisco. Today we're going to be talking about iliotibial band syndrome, or ITBS for short. Now, there are several causes of ITBS syndrome. A lot of those kind of fall under the category of repetitive stress injuries. So that could mean endurance sports, for example, like cycling or running. And these types of sports generally have a flexion-extension portion to them, which over a period of time can cause friction at the IT band. Now, what is the IT band? The IT band is a connective fibrous tissue that spans from the point of the hip down to the lateral part of the knee. And with repetition and overuse, there could be some friction at the distal part of the IT band, causing inflammation or edema. And sometimes it can actually feel kind of like a sharp, stingy pain. Again, usually happening with high endurance sports, such as cycling and running, especially hill running. So basically the band can rub on these bony areas at the lateral knee, causing the extra friction. It is diagnosed by palpation, pushing into the spots of tenderness. Again, it can feel more like a stinging or a sharp pain at the distal lateral part of the knee. And not always, but sometimes you can also see some edema or swelling at that region. Pain is usually felt with bending of the knee at 30 degrees. Now, I like to say iliotibial band or ITBS syndrome is definitely repairable. Everybody's situation is a little bit different. The source of the ITBS is usually coming from a pelvic imbalance or some sort of biomechanical dysfunction happening. And this is usually what we find to be the catalyst of iliotibial band syndrome. It can definitely affect a variety of demographics. It's not very age specific, but it does typically affect the endurance athlete as well as much as the amateur athlete. The immediate solution, of course, is to rest and stay away from high impact types of activities, and should be followed by therapy and exercises. What we found is that strengthening the gluteus muscle can offload the IT band, as well as stretching the IT band shortly thereafter. We do at the clinic help facilitate these exercises and also provide you with videos on how to do these exercises. I would also like to mention that therapy is a crucial and important piece to resolving ITBS or IT band syndrome. The best therapy would be a combination of different therapies, actually. So that could mean chiropractic, acupuncture, shockwave therapy, laser therapy are all beneficial in helping with IT band syndrome. The shockwave therapy is something that we utilize at the clinic, very specific to our location. It's using sound waves to break up that friction or scar tissue that gets formed from the repetitive stress injury at the point of pain. It's not uncommon to feel immediate relief after shockwave therapy. Of course, we want to pair this with other techniques in chiropractic like Graston Therapy and active release technique. Active release technique helps to take pressures off of the muscles surrounding the IT band. The IT band is exactly what the name implies, is a thin band. It's not actually a muscle, but we do work on the muscles that mirror or are close to it, adjacent to the IT band with active release technique or a form of pinning and stretching certain muscles, as well as using Graston technique, again, to break up any scar tissue where the friction might have been. So shockwave therapy, Graston therapy, and active release therapy. Now, if the ITBS is intense enough or very, very bothersome, we can also help with other adjacent or complementary treatments such as laser therapy or acupuncture. Recovery is typically between 4 to 6 weeks, but that doesn't mean that you won't see results even earlier. So you can start to see a pain reduction in the first couple weeks, but for full resolution, we can expect 4 to 6 weeks, depending on how long it's been there, your activity levels, and if you're following all the recommended exercises and stretches at home. Well, that comes from just good old, biomechanical stability. Things like foam rolling, not specifically at the IT band area, but at the muscles around the structure, as well as consistent stretching and taking breaks. And so these are ways to prevent ITBS or iliotibial band syndrome. I also like to say chiropractic because a big catalyst of ITBS is a pelvic imbalance and biomechanical imbalances. Well, chiropractic can help bring balance back into the pelvis, so that way there is not an imbalance within the muscles on both sides of the body. And so I think chiropractic is a good tool to have in your toolkit of preventable types of therapies for ITBS. The answer is no. You don't want to massage the area because sometimes foam rolling or massaging the spot can irritate an already inflamed area. Typically, you want to give it some extra rest and follow up with any specific therapies that your provider might recommend. The other thing is the rest part, right? So we want to make sure that we're staying away from typical exercises that can cause aggravation, such as running, cycling, and any sort of high impact activities that involve hills. Hills can put extra stress on the joints, causing a little bit more stress and pulling at the IT band. The answer is yes. It is repairable and curable and preventable. So we can make the IT band pain disappear completely and just never come back. And that comes with good therapy, consistent therapy, until you don't need the therapy any longer, and then follow up with exercises and stretches and strengthening of the muscles that surround the IT band to make sure that we eliminate it once and for all. A big telltale sign of having ITBS is pain at the lateral part of the knee, which means at the outside of the knee. And sometimes it can even feel like it's a bone bruise or a bone pain. And some have even gone as far as to say that their knee feels broken. The best way is to touch at the area of pain to see if it elicits any sort of sharp or stinging pain. The other way is also to bend your knee about 30 degrees to see if the pain is reproducible. And if it is, there is a good chance you might have ITBS. The official way, of course, to diagnose is to go in to see your chiropractor, acupuncturist, or physical therapist, or your primary provider. And they will be able to really zero in and focus in on where your pain is coming from, so that way they can officially give it a good diagnosis, so that way you get the right types of therapies. Many different causes, most of them kind of relate to more activity or physical stress, or what we call repetitive stress injuries or RSIs. So utilizing the knee over and over again, going through a flexion-extension motion can cause extra stress on that outside of the knee, causing what could be ITBS.